Hi, I'm Carolina. I'll be talking about the soleus muscle today. So the soleus muscle is located in the posterior aspect of the lower extremity, deep to the gastrocnemius muscle. Here in the diagram, you'll see it be a little bit transparent, and then the soleus muscle is right underneath. If you ever wanted to palpate this muscle, you can grab a partner, put them in the prone position, so face down, and then flex their leg to about 90 degrees or flex the knee to about 90 degrees, and then ask them to actively plantar flex, and you'll see that soleus muscle kind of pop out towards the sides underneath that gastrocnemius. So the origin and insertion of this muscle, the origin is at the posterior surface of the proximal fibula, right here, and the proximal 2/3 of the posterior tibial surface, which is more known as the soleal line. And it inserts into the posterior surface of the calcaneus via the calcaneal tendon, or more commonly known as the Achilles tendon. So what does a soleus actually do? So its main action is to plantar flex the ankle, since that's the only joint it crosses. Its main function in our body, while we are in an upright posture, while we're standing, it maintains our upright posture. It doesn't let us sway. It doesn't let us, succumb to the gravity forces. So it does this by being in a continuous state of plantar flexion. Another function that it has that not a lot of people are aware of is that it is a venous pump, so it returns your venous blood flow back to your heart, and this is considered the body's second heart. So anytime you use your soleus muscle, you're actually activating part of the circulatory system. With that being said, some of the activities of daily living that come from this muscle, anytime we walk, anytime we run, anytime we do a jumping jack, anytime we do any hopping or skipping, anything on our toes, it's activating that soleus muscle. So anytime you're pedaling on a bike, really good example. More commonly, anytime we drive. So if you're a driver, you are plantar flexing anytime you press on the gas, anytime you press on the brake, you're actively using that soleus. And then for the ladies, if you guys like to wear high heels, you're always in that constant plantar flexion state. So you're always actively using that soleus. And that brings us to some of the problems with the soleus muscle. If you're over wearing heels, you can cause a lot of pain into your soleus if you're not using recovery the right way, or you're not taking care of yourself the right way. One of the main causes of any of these injuries is muscle overload or muscle overuse, and that can lead to ruptures and tears. These usually occur in like long distance drivers or long distance runners due to fatigue and overtraining. And then, like I mentioned, pain is one of the biggest complaints of the soleus muscle. Usually the pain is brought on at the beginning of the exercise. It kind of goes away while you're exercising, and then it returns right after you're done training. This pain can be caused by trigger points in the muscle, and that restricts full concentric or eccentric contractions, allowing the muscle to do what it needs to do. This can then in fact cause the pain to be so unbearable that you can't place your weight on the heel. You can no longer walk uphill. You can no longer go up or down stairs just because the pain is so unbearable. But just a word of caution, if it's sudden calf pain that's very deep, it can also indicate deep vein thrombosis, which is really life-threatening. So you want to make sure you are getting the correct diagnosis for that. Okay, so how do we strengthen the soleus muscle? I have here seated calf raises. I also included a regular calf raise just to kind of show the difference and why we do a seated calf raise instead of just a regular calf raise. So here I'm going to show you the regular calf raise performed by this person. And you can see the engagement in the calf muscle. So mostly the gastrocnemius is being engaged in that muscle, in that exercise. So while you're doing a seated calf raise, you can see right here that soleus just pops out way more and it's way more engaged. The reason being because once you flex that knee slightly, any degree, it kind of takes off from the gastrocnemius. So you want to take off as much load as you can from the gastrocnemius to hit the soleus muscle, which is right underneath it. So you want to make sure you are flexing that knee. And then just right here is a quick little diagram of what that machine that they're using looks like in the gym. A lot of people tend to pull from their hands sometimes. So I've included some progressions and regressions in case you don't want to use that machine or you can't use that machine. So a quick regression for that is just to sit on a chair and use your body weight to do that plantar flexion movement. You want to actively be doing that. So you want to raise your calf and then lower it, and raise your calf and lower it. And you're going to do that as many times as is prescribed by whoever is overseeing your workouts. For a progression, because that machine, it tends to restrict sometimes, or it doesn't have the hard, like it's too easy for you. You can use a barbell. You put your free weights on there, you place it on your knees, and you also want to make sure that you always have right here like a plate or something to put your top of your toes on, just so you do have that full range of motion when your heel goes to the ground. And then that barbell kind of provides more of like a stability thing instead of having that machine kind of provide the stability for you. Another exercise you can do is a wall sit. So the seated calf raises were more like a concentric contraction for the muscle, and this wall sit is more of an isometric hold for plantar flexion, and it does help strengthen that muscle. So as you can tell right here with this guy, he has his knee slightly flexed and he is plantar flexing, and he's just holding that position against the wall. He has like a weight rack right here and like a couple things right here, just in case, let's say like you've never done this exercise before and your calf muscles start to cramp up, you have something to hold on to and kind of, help you there. A quick regression for that is to only have a slight bend at the knees. So you can be practically like standing up, just make sure you are kind of slightly bending that knee to be able to have that full plantar flexion motion while you're doing that isometric hold. You can hold that contraction for a lot less time, or if you necessarily cannot do that wall sit, you can always sit on a chair, like how the first exercise we had a modification to sit on the chair and do that plantar flexion. Instead of doing an active and contract and release, you would just hold it in that position for like 30 seconds and then lower it. And then you do it again and then hold. That's how you would modify that to someone that can't be on the wall. And if you want to make this exercise harder, you would lower your body more into a seated position. As you can see right here, he's mostly parallel instead of kind of like an angle how he was earlier. And then he has actually added more resistance to that by adding a dumbbell onto his knees. You can add a dumbbell. If you don't have a dumbbell, you can get a plate and put it on top of your knees, or even both, like how he has it here whenever you're ready for that. So one of the stretches that I found is a standing soleus stretch. So this, you can tell right here, he has his foot in a dorsiflex position against something sturdy. And then he does have that knee flexion going on, which is what's the most important takeaway for anything dealing with the soleus, is make sure that knee is flexed. A slight modification for that, if you don't have that full mobility, let's go back and show. So right here, he has really good range of motion for his ankle, but if someone doesn't have that range of motion yet to be able to do this stretch, you are more than welcome to reduce that angle of the ankle right there, and it makes the stretch a lot easier. And if you want to progress it or make it harder, obviously you can increase the time of the stretch, the angle that you're at, But you always want to make sure that that heel is on the ground, never like too far up where you're basically not getting that stretch. And then if you want to add any resistance bands to kind of try to pull your foot back down instead of like that dorsiflexion, you're more than welcome to do that to make it a little harder in a way. And then the next stretch that I found was the seated soleus stretch. Um, so this one you would grab like some type of band that doesn't stretch too much, a towel even, to do this stretch. You always want to make sure that you do have this like a foam roller or another towel rolled up under your knee, because like I said, the most important thing is about having that knee flexed or slightly flexed. So you want to make sure that you do have this raised up, and then you grab your little tool, your little towel, and you you dorsiflex that ankle to get that full stretch. And if it's difficult for you to get up and off the floor, because this is something that you do on the floor, you can do it seated. So we have here this little diagram right here. Obviously your tool that you're going to use to dorsiflex is going to be either a little bit longer and a little bit sturdier, so you can grab it from where you're seated and be able to pull up. The progression for this stretch would be to add a resistance band to create more force against the dorsiflexion and increase the time in the stretch, or the amount of times you do the stretch throughout the day. So before and after the workout, after you get out of the car, after you do, whatever it is that you want to increase the stretch for. And that is all I have for today. Thank you for coming. Bye.